Hey everybody, Joe Stauffacher here. Today I'm talking with Dr. Brett Brimhall, and peptides is a hot topic. So I was at Dr. Brett's office and I overheard him explaining peptides to some people, and I thought, we should share this with people. How can I capture this, Dr. Brett? So, Dr. Brett, with LifeVantage, I know that we've got P84, which is activating some peptides in the gut for people. Mind body system is helping people with peptides. But, like, what's really the difference between these activation products and the peptide conversation that's out there?
Great question. Let me just kind of back up a little bit. So I had this conversation with somebody else about peptides because I think probably every day I'm having a conversation around this idea of what a peptide is because you're seeing it a lot. Just so we all are clear, a peptide is a bunch of proteins hooked together. So the foundational building block of a protein is what's called an amino acid, and the body uses amino acids for a lot of different things for building muscle, but a lot also for communication. So they're called neurotransmitters in the brain at the protein molecule that it communicates. So a peptide is a small amount of amino acids hooked together that make up a specific message to the body. That's what it is. So for instance, a lot of people are familiar with this GLP-1 peptide. Um, and this is basically used to communicate with the body to say, hey, I'm full. I don't want anything else to eat. I mean, it does a lot more than that, but it communicates. If your body is not making these peptides, then it can't communicate in certain ways. So you're seeing a lot of these peptides being utilized for different systems to help somebody. So, for instance, the GLP-1 peptide, semaglutide, tirzepatide, some of those medications, whether they're compounded or not, they're communicating like and acting like or looking like what's called the GLP-1 hormone or peptide that tells the body I'm full, I don't want anything else to eat, so it helps people lose weight. Okay. Understand when your body is working optimally, it makes things that it needs. Now, the difference between something that your body's getting from the outside in versus making on its own is it can't regulate it. The phrase I like to use is if your body can make it, it can regulate it. For instance, let's just say the hormone of GLP-1, if your body needs more, it should be able to make more. But if you start to put it from the outside in, you don't know how much you need because your body's not saying I need 10% more, 20% more, 30% more. So you're putting at whatever dose till you have the symptomatic relief, but then your body's not now get the signal that it's making its own or it's coming from somewhere it doesn't need anymore. So how do you transition off of it? What's foundationally very different when it comes to even supplementation and what we call activation. Activation is the understanding the body has the ability, capacity, and desire to make the things that it needs. And if we can give it what it needs and then we create the right stimulus, the body can make it. For instance, if you want to build muscle, like you should be eating foods that help your body build muscle. And your muscles are made from protein. So if you're eating proteins and then the fuel that the muscle needs to fire, like creatine, which you'll hear a lot about people taking creatine when it comes to building muscle, and then you lift weights, your body has the nutrients and it has the signal to build muscle. Now, that the activation portion of that is not the proteins. The activation part of that is the exercise. So when you exercise, it tells your body, like you're lifting more weights, you need to build more muscle. LifeVantage specifically designs products, understanding that when you put certain products together in a certain way, your body makes certain things. And we do this all the time in cooking. Like we're going to cook, I don't know, bread. You have to put the right ingredients in the right ratios. Otherwise, your bread is not going to turn out the same. But then you put it in the oven. The oven is kind of an activator that makes all those things turn into bread. Your body is like that oven. It has inside each cell that has these big manufacturing assembly lines that makes things. It has to have the signal, it has to have the components, and then it has to have the cell. Looking at what LifeVantage is creating, that for instance, like the mind body system that we use, there's no GLP-1 in it. So what's happening is that when you're giving the body the things that it needs, the herbs, the vitamins, the nutrients, the fiber, and you put it into the body together, in the right way, the body can then make more GLP-1 hormone where it says, oh, I'm full, I'm satisfied, I don't need to eat any more food. And so people lose weight or build more muscle. And here's the key difference, especially with the GLP-1 story. In one of the clinical studies that we did with the mind body system, there was something unique that happened that we didn't expect. That everybody in the test group, nobody lost any muscle mass. And that's a huge component because no matter what weight loss you do, if you're doing calorie restriction or intermittent fasting or a particular hormone or peptide, synthetic or compound, a portion of the weight loss is muscle loss. I just had this conversation with her yesterday specifically on that, where her body fat percentage dropped, her muscle mass stayed the same. But she's using the mind body peptide. So the body's able to make its own, continue to maintain muscle mass, as opposed to when you're giving it an outside source, your body can't regulate that. So you will lose muscle mass.
And one of the things that I've noticed is that people don't really think of the heart being a muscle always. But if you're taking an antagonist GLP-1, you're probably not doing good things for your heart.
Well, I mean, I will kind of disagree with you on that just because of this, is that there are some cardiovascular benefits when it comes to if you, and that's one that the way the things you're seeing happen in the medication world is they're utilizing these medications to, because there is some cardiovascular heart protection or even like organ protections. So it's a little different in regards to that. Yes, you will lose muscle mass, but your heart is always working. Now, unfortunately, a lot of people aren't exercising. So if you're doing like a medication, like a GLP-1 medication, you have to exercise. Have to exercise and have to be conscious of taking in protein. So I don't know about the heart muscle. I'm sure you will lose some in regards to that. I just don't know how much. But it is that is very, 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 very true when it comes to caloric restriction and specifically things like anorexia, bulimia, when your body is not taking in adequate proteins, the body tends to burn muscle easier than it burns fat. So it will, in fact, still muscle. So there are individuals that they'll have cardiovascular problems when they are too much caloric restriction. Unfortunately, I know about that personally with some family. So that there's some reality to that part of it. But understanding peptides is this: if you're thinking about using peptides, I think they're hugely beneficial. You always want your body to make its own. Now, these peptides aren't magical. This body is magical. The body has to communicate. So those peptides are communication proteins that tell the body to do certain things. Whether you're talking about the Wolverine protocol, whether you're talking about the semaglutides, or whether you're talking about some of the melanosan or some of the other peptides, the communication that these peptides are having are causing your cells to do the thing. Your cells are still doing the thing. Your body can and is designed and it wants to like repair and regulate. So I always say peptides do this. They first have to be there to help regulate. But in order for your body to make the thing, it has to be repaired. When whatever cell is struggling, let's say it's an intestinal cell, if the intestinal cell is not healthy, it can't it's not repaired enough to to perform its normal function, so it can't regulate. What, for instance, the P84 system that you mentioned, that we use the microbiome system, what we have found with this, because it's called P84, so there's 84 plus things in this that helps the body first repair the microbiome system. And the microbiome, people think, well, it's the gut. No, no, no. Microbiome is butt and mouth to butt. It's everything. It's everything in between that has to work in order to, but it has to be repaired first. So think about the job of the mouth is to take in food, digest it, break it down, assimilate it, and eliminate it. That's its job. But it also its job is to have the immune system lives in your gut. A lot of the hormones and proteins are made in your gut. A lot of the peptides are made in your gut. So what we've learned and we've tested with LifeVantage is to understand that peptides are important. So we tested that and we know that the microbiome P84 system specifically helps to regulate 14 different peptides. 14 different peptides. And the reason it's not because it has any of the peptides in it. That's why it's not. It doesn't have those peptides in it. When the gut is repaired, it restores to its normal function, and then it can create the things to regulate. And you think of regulation of just having good bowel movements, great, that's a good regulation. But regulation also is mental health, is your ability to regulate the proteins your body takes in, assimilates, and creates the neurotransmitters so your brain feels happy, and to regulate the immune system. Like we don't want like the immune system to be hyper or hypo, like too high or too low. We want it to be just right. And that is partially that is a lot done through the digestive tract. 80, they say between 70 and 85+% of the immune system in your gut. So if the gut is not healthy, it cannot perform its task when it comes to immune response, which is, hey, getting over infection, but it also is everything to do with having autoimmune problems. That's what I love about the P84 microbiome system when I'm using with people. I love that it's super easy and people feel a response with it. And I know we're repairing. And once it's repaired, I know we're restoring. And when we're restoring, we know now we're regulating. So a lot of people have other improvement in symptoms that they didn't expect from a gut thing because your body, nothing is in you until it's through your gut. And that's also good because you don't want stuff that gets in that could get in you that you don't want there. And that's a lot of that communication happens through peptides. So these peptide stories, I think the key are their peptides are awesome, they're helpful, they're powerful, they're important. It's going to change. It's changing a lot of people's life. But always understand if your body is not making it, it cannot regulate it, and you have to have healthy cells to make its own peptides, let alone regulate them. So yes, if you're going to use a peptide, awesome. What's the long-term play? I have to get my body back in a healthy position to where it can make its own.
And you kind of said that too when you're saying that our gut does these things in making the peptides and regulating it, where when people are injecting it, then they're putting it in through a system that the body is not even used to.
Correct. And it's really not. And it's worse. I understand, like, if you got somebody and I've had people with massive problems, and the injectables have been just life-saving for them because it's given them a place where now, hey, now I can do it on my own. Like I was so overwhelmed and I feel like I had no control. And now I feel like I'm in that spot. Great. Now, but what's the long-term play? Because what we don't know the long-term consequences nor benefit, I should say, when it comes to these injectables. What I do know, the one thing is when you have to inject them all the time is the cost. I want the body to be able to restore and regulate the best it can as long as we can. And I really truly believe let's activate the body's ability to do what it's designed to do. So use activation-based products. So if this conversation around activation is new to you, really dig into it. This is a new generation of products around the science of activation, which is understanding the cells have a capacity, a desire, and want to do their thing. They want to be able to do their thing. But if they aren't doing their thing because they're older cells or they're sicker cells, you want to get them back activated, which is activation is be able to regulate inflammation, be able to make cellular energy, and to be able to communicate. That's really the foundation. And what LifeVantage specifically does is their focus and understand is how that process works. So when they're making products, they're not trying to make ingredients that like, hey, this is what the cell needs to make this. They're saying, hey, what is the process that we need to do in order for the cell to turn back on so then it can do its thing? Very different process and thought process.
Thank you so much for your time today, Dr. Brett.
I
Appreciate it.
appreciate it. Great questions, and hopefully this helps some people. And if you have, again, if this is new to you, great. Let's have a conversation around this and let that be a part of your life. And activations, it's getting around. Here's one quick quote I'll give you that I think is powerful. This idea of activation, science is starting to understand, which is why you're seeing all these peptides, by the way. Like the peptides come from an activation story because it's not the peptide that's the magic, it's what the peptides cause the cell to do is the magic. So it's a form of activation. Um, there's a specific switch on your cells. They call it the NRF2 switch. Now, this particular switch is responsible when it's turned on for your body's ability to make the things that help the body regulate inflammation and clean up. Many of us have heard what's called glutathione. Glutathione is this massive antioxidant that when we have it, it helps your body repair faster faster than almost anything else, especially brain-based wise. So the NRF2 not only regulates that one, but it regulates another one called catalase, another one called superoxide dismutase. But here is what the science of activation is. If you Washington State University back in 2015 says that they believe that the activation of nerve 2 is the most extraordinary preventative and therapeutic breakthrough in the history of medicine. That's what they said. They believe that if they could understand how to activate nerve 2 has some of the biggest potential benefit, both therapeutically and preventively in the history of medicine. So if you're not familiar with nerve 2, if you're not familiar with this idea of activation, this is where science is going. Now, understanding that when research happens, it's 10, 15, 20 years before it becomes like public knowledge. This is things that we've been doing with LifeVantage, and I've been using with patients. They started doing some of this stuff back in the early 2000s. I wasn't fully exposed to it till around 2014. It's what I've been using since then to really help people. So if you're not familiar with that, it's time. Let's dive into it because how you feel today, like how well you function, like how well you sleep, how well you heal, repair, how fast you recover, is directly equal to how activated your cells are and how well they make energy and how well they regulate. So you'll appreciate that. And that's helping people.
Awesome. And I'll drop the link to the investigative report that goes through the NRF2 science that Dr. Brett was just referencing in the description below. So if somebody's looking for that, they can check that out immediately.
Okay. All right. I appreciate you.
Thank you.